All right, well, welcome. I think Holly announced some of the order, but we're going to hear, as she was saying, from Lori Chillingsworth with the Salt Lake Chamber of Commerce, David Litvak, Sheriff Jim Winder, myself, and Representative Dunnigan. So why don't we start with you, Lori?
Good morning. My name is Lori Chillingworth, and I'm the Executive Vice President of Zions Bank, and I'm also the current chair of the Salt Lake Chamber. It's in this capacity today that I address you. A healthy workforce is necessary for a productive economy. We support efforts to address the state's critical homeless challenge and have encouraged statesmanship to develop a Utah solution to the Medicaid coverage gap. This bill supports this criteria. The business community supports Medicaid expansion because it's good for Utah's economy. It's good for employers and it's good for employees. This bill will also provide important substance abuse counseling and mental health coverage for many of Utah's most vulnerable and our homeless community. The Chamber believes it's critically important to move forward on the Medicare expansion bill this year and support Representative Dunnigan's bill because it is the greatest likelihood of passing both houses of the Utah legislature and the federal administration. Representative Dunnigan has worked diligently to find a common sense Utah approach that respects the taxpayer while providing coverage for some of Utah's most vulnerable. The Salt Lake Chamber appreciates his commitment and his statesmanlike approach to this issue. We ask for your support of this bill. Thank you very much.
Good morning. I'm David Litvak, Deputy Chief of Staff in Mayor Biskupski's office. I apologize that the mayor could not be here. As was explained, she has lost her voice. I was asked to step in for two reasons. One, we have similar hair. And two, we're both from Minnesota. I want to thank you for joining us this morning. Thank Mayor McAdams, Representative Dunnigan, and all those here today to lend their support on this vital issue. House Bill 437, Representative Dunnigan's proposal, offers full Medicaid benefits to 16,000 of the poorest people in Utah, many of them homeless and many of them struggling with mental illness and substance abuse. These individuals, sadly, tend to fly well below society's radar. Representative Dunnigan's bill is our best opportunity this legislative session to ensure that the poorest of the poor in our state get health care coverage. These are individuals who have no other path to the most basic medical care. So this makes economic sense, and it is also the humane and compassionate thing to do. This legislation helps to support the greater funding mechanism that Mayor McAdams and Mayor Biskupski, as well as many community advocates, are seeking to address homelessness, shelters, and services needed throughout our state. This Medicaid expansion would allow us to better leverage funding for a broad spectrum of programs that help people build stability and safety into their lives. I must acknowledge that there is another bill this session, Senate Bill 77, sponsored by Senator Gene Davis, that proposes full Medicaid expansion. And we know there are many in the community that feel that this would be the optimal solution. But there's simply not the political support to move in that direction. And we cannot let that be in the way of making a critical and important step forward, and the hard work done by Representative Dunnigan. I want to thank Representative Dunnigan on behalf of Salt Lake City's most vulnerable population. We are pleased, and the Mayor Biskupski is pleased, to offer our support for this legislation. Thank you.
Good morning, ladies and gentlemen. My name is Jim Winder. I'm the Salt Lake County Sheriff. Many of you over the course of the last few years have heard me speak, as have my colleagues, on many occasions about the need for criminal justice reform. In fact, we as a state have taken a leadership role, as has Salt Lake County, in terms of attempts to divert the criminal and the indigent population away from the criminal justice system into something much more meaningful. That simply cannot occur without money. That's right, people ask me all the time, what can we do to keep people out of jail? And the bottom line is provide services. In the Salt Lake County Jail, we process nearly 40,000 of our fellow citizens every year through those doors, the vast majority of whom have no access to health care or mental health care, and that results in their criminality. This bill, as has been indicated, which is a compromise, is something. It is something to hold on to. Last year, many of us in the criminal justice community were devastated at the news that the discussions of Medicaid expansion were simply dead. Thank God they are not dead. Thank God that good people like Representative Dunnigan and others in the Utah legislature have seen fit to revitalize this critical effort and to move forward on a compromise. And after all, isn't that what we do in government, is to compromise to help our citizens? I fully support the initiative and would encourage the rest of the legislature to move forward on this critical move to support Utah's most needy individuals. Thank you.
Well, thank you. I also want to add my words of gratitude and support to Representative Dunnigan, and thank my colleague Mayor Biskupski and other legislators, Sheriff Winder, who stand here today in support of House Bill 437 and bringing forward a consensus approach to extending Medicaid benefits to those in need. Access to health care is important to everyone, but it is a lifeline for the people that Representative Dunnigan's bill will reach. There are significant numbers of low-income individuals with behavioral health problems that cycle in and out of our jail and in and out of our homeless services system, and they struggle with access to limited treatment options. These are the people that Representative Dunnigan's bill will help. To the 16,000 Utahns who find themselves in desperate need of health care and suffer from mental illness, we say to them today, help is on the way. They have both physical and behavioral health problems that complicate their ability to break the cycle of recidivism and get back to stable, self-reliant, and productive lives. We all support the goals of justice reinvestment, particularly as it relates to getting people who don't belong in prison out of prison and into treatment for their substance abuse and for their mental health issues. But we all know that will require additional healthcare resources and funding in this case, so that treatment beds and treatment programs are available to those in greatest need. It's the right thing to do for the human beings that we are trying to help. It is also the right thing to do for the taxpayer. Research shows that every dollar we spend on substance use disorder treatment saves $4 in healthcare costs and $7 in law enforcement and other criminal justice costs. We hope that in the future our state legislators will look towards serving all of the uninsured in Utah. Representative Dunnigan's bill is a step in the right direction. I support his bill wholeheartedly and thank him for his years of work to prioritize services for this population that is our responsibility in Salt Lake County to serve. Thank you.
Good morning. I'm Representative Jim Dunnigan. I want to thank Mayor McAdams, Mayor Biskupski, Sheriff Winder, the business community, the chamber, and my colleagues for supporting this path forward for those 16,000 Utahns who need help and who need services. As has been mentioned, last year we passed a significant piece of legislation in the criminal justice reform. But that Justice Reinvestment Initiative needs medical treatment for those that are interacting with the justice system. This legislation will accomplish a lot of that. In addition, it addresses the homeless initiative that is very critical and very important to not only Salt Lake City and Salt Lake County, but to our state. This bill also provides great assistance to that population. So it's a triple threat. It does three things. It provides medical services for those who are most deserving, those in extreme poverty. It also helps provide a treatment path for those in the that will be interacting with the criminal justice system, and also gives an opportunity for those who are homeless to get medical care, to get the physical care and the behavioral health, substance abuse treatment that they need so that they have the opportunity to become productive members of our society. I just want to thank everybody. This is, I think, a great effort of bipartisanship and people who are more interested in establishing good policy and taking care of our fellow Utahns than worrying about the politics. I would just like to say policy above politics, and I think this is a great example. To my colleagues in the House and the Senate, several who are here who have supported this concept and will continue to support it, I invite them to help me and assist me getting this legislation through the House and through the Senate so we can get it implemented for our fellow Utahns. Thank you.
All right, thank you. I think that's it. People are, of course, available for one-on-ones, but appreciate you being here. Yeah, do you want questions at the podium? We can do that. Yep. Representative Dunnigan.
Mayor McAdams, let me start with you.
Sure.
You're a former lawmaker. How do you justify to taxpayers not doing full Medicaid expansion when we bring more money to the state, cover more people, be less of an expense? How do you
Yeah,
justify that?
well, the legislative process is the art of the possible. And I certainly support full Medicaid expansion. I think we would love to see that move forward. Representative Dunnigan has worked with his colleagues in the House to try to find that consensus approach that can move forward. What we know is that something is better than nothing. And his proposal will provide critical health care services to a population in dire need and do it in a way that will actually save tax dollars. We talked about $4 in savings in health care costs through prevention, $7 in criminal justice savings. So this appears to be the approach that is gaining the broadest support in the House, and you know, I think of those 16,000 people who I see on our streets and coming in and out of our jails who are in need of help, and I can't turn away from any proposal that's going to offer help to those people. It'll do it in a way that is fiscally responsible, and hopefully we'll see it pass.
It's Representative Dunnigan. It sounds a little as if you're a poor guy and you're struggling to get by, you don't have much money, and you keep your nose clean. What you need to do is commit a couple of house burglaries and get on drugs, and then you get insurance.
What we're trying to do is help those who are probably the most disadvantaged. And so what this is, it's a matter of priorities. And prioritization for those who are homeless, who need behavioral health treatment, or who are in the criminal justice system, they all affect our lives. It's not like if we don't do anything, then our lives aren't impacted. Not only are we impacting their lives, but they'll also affect our lives.
Are you helping particularly people who behave bad? Are you putting an incentive?
No, many of these people don't behave badly. They have mental health issues, or they have physical health issues. They can't get employed because they need some medical assistance.
Some of them are coming out of jail, right? Maybe they
Some are coming out of jail. As the sheriff said, we hope to divert, instead of putting so many in jail or prison, to get them treatment and offer that as a diversion opportunity, which is a much more effective and less expensive way to do it.
Is that part of an incentive to bad behavior?
I certainly don't think so. I happen to spend some time in the jail every week, and I don't think the folks that I meet with in there are incentivized to be in there.
Mayor McAdams, is there a concern from either your office or Mayor Biskupski's office that by putting your weight behind this bill, as you said, something more than is better than nothing, is there a concern that that actually takes away any political pressure for a more expanded version of Medicaid in the future?
I with all due respect to Senator Davis, and I've committed my support for his bill as well, I think, and I don't want to speak for the House of Representatives, but I think we've seen over the last couple of years what the appetite is of the House for a full Medicaid expansion or something less, similar to Governor Herbert's Healthy Utah plan or other plans that have come forward. And so we are looking at how we can get support to the neediest of Utahns, get it as quickly as possible. I believe that Representative Dunnigan Dunnigan's bill is a big step in the right direction to providing access and support to them, and we hope that his bill will receive support from the House and then from the Senate, and then it's going to this conversation, this analysis will refine over time, and we're going to have to look what steps we take moving forward. But there are people in our community in critical need today, and I feel a moral obligation to support any plan that can get them help.
Do you feel like this is a step and more will be done in the future, or do you think this might be the end of it?
Well, I certainly hope that more will be done in the future. I think there are others who may see this as who may have other opinions, but that the policy making process is a ongoing and living process, and so we'll talk about next steps in the future.
What is your opinion and takeaway from the police shooting? What's happened?
Well, first of all, that is a tragedy, and a tragedy I think that is on the consciousness of all of our community. I think we'll have to see over the next several weeks how that takes shape as we gather more information and understand that tragedy. But certainly public safety is at the forefront of our minds, and ensuring that our public is safe is of critical importance, and ensuring those who are in need get the treatment that they need is also part of our responsibility.
Do you think the body camera video should be released?
I don't have, I'm not privy to any information on that, and so I would just like to see the process move forward as it has thus far, and in due time I think we'll have the information we need to make an appropriate judgment.
Representative Dunnigan, could you tell us what's the fiscal note on this?
What's that?
What's the fiscal note?
The general fund required will be about $17.5 million after the hospitals contribute there. So the fiscal note that we'll have to come up with as a state is about $17.5 million.
Okay, now I think I'm right. We'd get a free year if we did full expansion. Is that right? We'd get this costs $17.5 million more to insure 16,000, and full expansion cost to insure 60,000.
2016, this calendar year, is the last year had we fully expanded to get 100% funding.
Okay, and in the future we'd get 90 with the governor's plan or with full expansion.
Eventually it goes to 90%, that's right.
What kind of comparison can you offer between 60,000 at 90% versus 16,000 at 75%?
Well, if we fully expand Medicaid, there's no cap on the costs. Federal government doesn't allow us to have any type of capping mechanism. The proposal that I'm working on, it's subject to appropriations. So we can slide the lever, we can cover more, we can cover fewer, but they said that we need to play within our current Medicaid match of 70%, 30%, meaning the feds pay 70%, we pay 70 or 30% in order to have the ability to control our appropriations. If we fully expand Medicaid, there's no cap. Whatever it costs, other states have seen their costs come in 2-3 times what they initially thought.
Is there some kind of cost comparison possible? These are hypothetical about the cap or a safety net for the state, but is there some kind of cost comparison possible between this plan at 70% for 16,000 people and the other plan at 90% for 60,000 people?
Well, of the 60,000, our actuaries say that about 20,000 have insurance of some type. And you cannot get the enhanced 90% match if you only cover 60,000 and go to 100% of poverty. You have to go to 100% or 138% of poverty, which covers tens of thousands of Utahns that already have subsidy. But right now, the federal government's paying 100% of that subsidy. We would have to start paying that 10%. And that 10% would cost our state over $200 million per year.
Okay, so this we're getting 17.5 state. That would be 200 million.
Well, it's a little more complicated than a 10-second conversation, but right now, for the population between 100 and 138% of poverty, federal government pays all of the subsidies, all of the cost-sharing reductions. If we do full expansion, we have to take over that responsibility. I think it's worthwhile knowing that according to our analysts, last year we sent $710 million to the federal government in taxes and fees due to Obamacare. We received $730 million back due to Obamacare. So we are recovering 100% without any expansion our tax dollars that we have sent back.
Representative Dunnigan, what message do you have for those still in the coverage gap under your bill? Can they be assured that if there are revenues available next session, say, more of them will be covered? I mean, what assurance?
Well, perhaps the bill that I'm working on seems to be an easy thing, to accomplish. It's not. It's been quite challenging. And what I am focused on is providing full Medicaid coverage as quickly as possible for the 16,000 people who are homeless, who are interacting with the criminal justice system, or who have physical, behavioral, mental health needs. And that's what I'm focusing on, trying to accomplish that. And it's not done yet. I'm well aware that it's passed the House committee. Now it's still got to pass the House and then the Senate and get the signature of the governor. And that's what I'm focusing on.
But what would you say to those people who are listening to this saying,
What I would say is I'm focusing on the 16,000 that are in my bill, and that's my goal, is to try to help them this year.
Why do you think it is that the House might be willing to focus on these 16,000 who certainly are in need of coverage, but doesn't have the appetite to help others who need it as well?
I think there are many in the House that have two concerns. One is they agree that those that are most deserving, those in extreme poverty, have behavioral and substance abuse issues, should be helped, and that's what this bill does. Secondly, they're very concerned that we don't just have an open-ended checkbook and start a program that might run out of control. We're already budgeting this year for about $38 million of Medicaid higher costs that we think we're going to experience this coming year than we did last year. That's in our current Medicaid program. So they're very concerned about expanding anything without some cost control. That's why, for many of my colleagues, it's absolutely critical that we have the cost control mechanism where we can cover people and appropriate money and know that that's our obligation, and we'll cover those 16,000, and that's what House Bill 437 does.
If the politics weren't an issue, would it be your preference to cover the entire gap?
If politics were not an issue, the whole world would look a lot different for me, so that's a long discussion. Any other questions?
Can you talk about the provision that was added in the substitute on your bill to go to the federal government once the new administration takes office and look for that 90-10 match up to 100%?
That's a proposal in Senator Shiwazawa's and Representative Spenlow's bill.
I thought that was included in your substitute.
I don't believe so.
Is that something you support?
In separate bills, not in my bill. Any others?
I would just add, I think, in conclusion, again, this is a compassionate approach. And if we could go back in time 5 years to a time before the Affordable Care Act and be having a conversation about extending Medicaid benefits to 16,000 of Utah's poorest, most needy individuals, I can't imagine that would be controversial from my side of the aisle. I am pleased and honored to stand here today in support of people in critical need. This is the hardest population, this is the most expensive population, and the population of Utahns in dire need of health care and behavioral health support. And so today I stand in support of a proposal that will be a lifeline to a population who desperately needs help. And help is on the way. If we can get this bill through the House and the Senate, we can get them the support that they very much need. Thank you.